Paul.
Mr. Drakeford, before the break we were talking about the 10th of May, and on the 11th of May you held a press conference to explain the changes to the regulations that would come into effect in Wales that day, and we can see the text of that at INQ 4090562, and the fourth bullet point there outlines the changes. People are allowed to exercise more than once a day, garden centres allowed to open, people must comply with social distancing. If we have a look a bit further down the page, there's an acknowledgement that confusion may be caused as a result of differences in the messaging between Wales and England. And then if we go over the page to the second bullet point on page 2, you say, I want to be clear, in Wales, Welsh rules will apply. Going back to where we left off before the break, could more have been done to make it clear that the UK government's stay alert message only applied in England?
Well, as I said before the break, I certainly think the Prime Minister could have done more to have explained that when he announced it. We did make really consistent efforts to communicate with people, and particularly people along the border where those differences are most acute, although, of course, that is where people are most used to differences, because there are differences all the time after 25 years of devolution. But I myself would give interviews not simply to Welsh media outlets, but I would be giving interviews to the Shropshire Star and to other local newspapers along the border in order to do whatever we could to communicate to people the rules that would apply to them while they were in Wales.
In a question and answer session, I think following on from this press conference that we're looking at here, you were asked about comments that had been made, I think, that morning on breakfast television by the then Deputy Prime Minister, Mr. Raab. Mr. Raab had said that people in England should use common sense when meeting up outdoors, and provided that they observe 2-metre social distancing, that is okay. Now, in Wales, the regulations were clear. Leaving home for a pre-arranged meeting with someone from another household was not permitted, even if this was outdoors, observing social distancing. And when asked to comment on what Mr. Raab had said, you are reported as saying that it didn't amount to any real change. The rules, you said, in Wales are that 2 people can meet, providing they observe social distancing. So if one person from a household is going out and meeting another member of their family, then under our rules, that would be permitted. I think it would be right to say that your comments were interpreted by some in Wales as meaning, effectively, it was okay to arrange to meet someone from another household outside, provided social distancing was observed, but that was not permitted. And I think the Welsh Government issued a statement after your press conference to correct any wrong interpretation of what you had said. Do you accept that your comments were potentially misleading?
Well, I'm certainly in trouble over what I had said, and you are on your feet, you are answering unscripted questions. You sometimes don't say things in exactly the way that you'd intended. The distinction I was trying to make is the one, Mr. Poole, you've made. But, and I made the point at the time, I used to, in those very early days, Cardiff Council kept allotments open for the 1 hour you were allowed out. So I would cycle to my allotment for 45 minutes and cycle home again. And as I would do so, I would see people absolutely scrupulously obeying the rules. And by chance, not by design, they would see somebody they knew on the other side of the road, and they would say hello to them or hope you're okay. And I was being asked whether that was somehow against the rules, that you couldn't even acknowledge somebody. And the point I was trying to make was that there was nothing wrong with that. Going out purposely to meet other people was clearly against the rules, and that's the distinction that we tried to clarify.
You say at paragraph 49 of your witness statement for this module that you are in favour of strong debate when difficult decisions had to be made, and you say when physical meetings were not possible, some of the interaction defaulted to informal means. And obviously during much of the pandemic, particularly lockdown periods, virtual meetings became the default. And you say these obviously would be supplemented by telephone calls and emails. And one of the informal means of communication that you specifically reference in this context, where physical meetings were not possible, is the use of text and WhatsApp messages. So I want to ask you some questions about your use of text and WhatsApp during the pandemic. Now, it's been widely reported in the press that you had to correct the record in the Senate when you said that you did not use WhatsApp. And just to be clear, it's right, isn't it, Mr. Drakeford, that you did use WhatsApp to communicate with Welsh ministers and others, such as the First Minister of Scotland, during the pandemic?
I used WhatsApp on 11 occasions in the whole of the very many months of the pandemic. I don't believe I used WhatsApp to communicate with the First Minister of Scotland. I would have had text messages with her, certainly. But in terms of WhatsApp, I've had the record checked. There are 11 occasions. One of those, I say, thanks. That's one of them. And another one, I complain that I can't hear the sound of the Senate when I'm meant to be answering questions. I did, it's certainly true, I did use, but I'm a very, very infrequent user of WhatsApp. I'm a much more frequent user of text messages.
Dame Sian Morgan was taken to a number of Welsh Government policies concerning the use of informal methods of communication and also the importance of keeping records. Do you accept that using WhatsApp to discuss Welsh Government business was prohibited by those policies?
I do accept that. It's the policy that's wrong, not the practice.
Do you accept, as Jane Runnacles, your most senior advisor, did when giving her evidence, that using WhatsApp, even for administrative purposes, was wrong?
It was against the policy of 2009. In the circumstances of 2009, the policy no doubt was a sound one. In the circumstances of dealing with a pandemic, the policy did not make sense.
Even if the policy were to change to allow the use of WhatsApp and text messages and other informal methods of communication, I assume you wouldn't be advocating for a change to the policy of the importance of retaining such messages. Because, as you know, it's not simply a question of whether informal methods such as text and WhatsApp were used to make decisions. It's necessary to see discussions that led to decisions or led to decisions not being made. And that's important to retain those records. Do you agree?
I understand the point that's being made. My own experience is looking at text messages. They're not used even for background to policy making very often, and there are many other far more informative sources available that show the workings out before a policy is concluded. But I don't disagree with the point, but I don't myself believe that they would be very helpful to anybody looking to understand the arguments that lay behind decisions. Certainly much less useful than many other sources that are available.
Did you ever give a direction to Welsh ministers and Welsh government officials for messages not to be deleted and for records to be retained?
No.
When you were made aware of this inquiry being formed, did you discuss with cabinet colleagues or officials for the need for such messages to be retained for the purposes of this inquiry?
No.
Why not?
It would not have occurred to me that I would need to do so.
You're aware that the disappearing messages function was turned on by a number of officials, including Jane Runnacles. Also, Mr. Miles yesterday said that he enabled this when it became available on his phone. Is that something that surprises you?
Insofar as I am well informed about these things, I think it's what people do all the time. And I don't think people would have been doing it with an eye to a future inquiry when they did so. Now that the spotlight has been shone on these matters in the way that it has, then it would have been better had things not been deleted. But I don't believe that it was in order to escape the gaze of anybody else that people would have taken that very ordinary decision.
And it's right to say that although you have shared messages with the inquiry, you have not been able to recover messages for the period July 2018 to March 2021 from your Senedd-issued mobile phone, have you?
Apparently not.
can you tell us what efforts have been made to recover those messages?
Well, I use only one telephone. There are a number of telephones you could use, but I use only the one, and that's the one supplied to me as a member of the Senate, not as a Welsh Government minister. I have no knowledge of or expertise in the way in which messages are stored or not stored, and as soon as the inquiry asked for messages, then my phone was handed over and all the messages available have been made available to the inquiry. I would have no way of knowing where they were stored or how they were stored or which were still available, but efforts would have been made by Senate technical staff with that competence to make sure that the inquiry had everything that was available.
Mr. Beckford, changing topic, and we've looked at the 10th of May, which appears to be something of a turning point in terms of coordination between the four nations. And the inquiry has heard evidence that would tend to indicate that between some differences between the four nations were obviously simply a matter of timing, others were more substantive. The general pattern, though, perhaps with the exception of schools, where England reopened schools first in early June, and then that was followed by Wales. With that exception, the general pattern seems to be England and Northern Ireland easing restrictions and then reopening the economy first, followed next by Scotland and then Wales. Dr. Di Lloyd, who's the chair of the Health and Social Care and Sport Committee in the Senate, he told the Institute for Government that the Welsh Government had taken a general cautious approach, which is reflective of Welsh society. Does this explain the pattern that we've just been looking at? And if not, what is the explanation?
Well, I think it is true to say that we did take a more cautious approach to the lifting of protections. Mostly that is done because of the advice that we have, which is that in opening up Wales again, you ought to do it one step at a time and with sufficient time between measures to be able to assess the impact of those measures on the circulation of the virus. That is the essential reason. Dr. Lloyd is right, however, that Welsh opinion was always, I'll put it slightly differently if I could, for every one person who replied to various opinion surveys in Wales who thought we were too slow in lifting protections, there were two people who thought we were going too quickly. So the temper of public opinion in Wales was in favour of that more gradual and cautious approach. So we were acting consistently with the centre of gravity of Welsh public opinion.
There's a cabinet meeting on the 27th of May. If we can go to those minutes, they're INQ 404896. And if we can have a look at page 2, please, paragraph 1.1. The focus of this meeting was on the next 21-day review, which had to be carried out by the 29th of May. If we can have a look at paragraph 1.5, please. Transmission rate at this point, 27th of May, was under 1. It was 0.87. Substantially changed since the last review. There'd been decreases in admissions suggesting that the rate was falling. And then if we have a look at page 3, please, paragraph 1.9. There's a proposal that the regulations be amended to change the stay-at-home provisions to stay local. And then further down that same page, 1.14, the proposal to allow 2 different households to meet outside subject to social distancing being maintained. And I'm right in saying Cabinet agreed both of those changes ought to be made to the regulations. That's right, isn't it?
That is right.
What did Cabinet decide at this point in time, so this is 27th of May, in respect of reopening schools and childcare settings?
At this point, the Cabinet decides that we want schools to be able to resume education. We have a plan that the Education Minister leads, which would be to bring the school term to an end early and for schools to reopen early in August, because that would have given us the maximum amount of time for schools to be in operation at the best time of the year when the risks were lowest. So we are planning for the resumption of face-to-face education, and the Education Minister has proposed that as the plan that would give children the maximum amount of time in the classroom and in the safest conditions. We are unable to bring that plan to fruition because it is opposed by the teacher unions, whose argument is that they have a contract that means that they can't be asked to rearrange their holiday time. The Education Minister moves to her next plan, which is to ask schools to continue the summer term for 1 week extra and to bring children back to school for 4 weeks before the end of the term, and to give schools that 1 week back in holiday term time in October. Again, unfortunately, in my view, the teacher unions oppose that as well. 3 education authorities out of 22 in Wales go ahead with the Education Minister's plans, but the other 19 feel they can't overcome the objections of teachers to it. So we end up with schools going back in Wales before the end of the summer term, but for 3 weeks in most cases rather than the 4 we would have preferred.
I think Miss Williams, Kirsty Williams, then Minister of Education, she says in her witness statement, on the 29th of June 2020, schools across Wales opened to pupils from all year groups for limited periods during the week, with only a third of pupils in school at any one time. She states that she was proud that Wales was the only UK nation where all pupils had the opportunity to attend school before the summer break. There had been advice given by TAC in a report to the Cabinet on the 27th of May that there was insufficient headroom for schools to reopen. Do you think, in light of that, that the correct decision was made to for schools to resume some form of face-to-face teaching prior to the summer holidays?
I do, because that is a month later from the TAC advice, and the basic patterns across the United Kingdom are the same. And at this period, we are all heading into better times, better territory, and we are all looking to use the headroom, as we called it, that provides to be able to restore some of the activities that otherwise would have been there. On the 27th of May, we didn't open schools that day, but we are giving what the Bank of England would call forward guidance, and we are anticipating the fact that things will continue to improve, as SAGE has told us they will, and we'll come to a point when it will be safe for that to happen, and we're planning purposefully for that.
In June 2020, that's when MIGs, Ministerial Intergovernmental Groups, were replaced with COVID-S, Prime Minister's Strategy Group, COVID-O, the Operations Committee that we know was chaired by Mr Gove. I'm right in saying that the devolved administrations were not invited to attend COVID-S meetings and were not invited to attend COVID-O meetings on a standing basis until October 2020. What impact did the decision to replace MIGs with COVID-O and COVID-S have on Welsh Government decision-making?
Well, I think the first thing to say is that we're not involved in that decision. No attempt is made to ask devolved governments how those arrangements might best be deployed. We're simply informed that the decision has been taken. It means, I think, that we are even further away from that regular, reliable engagement between us that I would like to have seen. We're not involved at all in the strategic thinking of the UK government, and we're only involved in the operational side of it when they decide that it would be useful for us to be in the room. I do not believe that that was a satisfactory basis on which to navigate a four-nation approach to the challenges that we all faced.
And you voiced some of those concerns in a letter you write to Mr Gove on the 11th of June. We can see that letter, INQ 30216-519. Second paragraph on that first page, you point out that COBRA last met on the 10th of May. You last heard from the Prime Minister on the 28th of May. This is obviously now the 11th of June. Through official channels, you'd also learnt that COBRA had been stood down and that there were plans to scale back the SAGE arrangements. You then note 3 announcements that had been made by the UK government. 4th of June, mandatory face coverings on public transport. 5th of June, face masks in NHS facilities. And 10th of June, bubble for single-person households. And you make the point that those announcements were made with minimal or no prior communication. You then say that those have big practical implications for Wales, directly or indirectly. Just explain to us what you mean by that last sentence.
Well, I'm afraid that those announcements will again have been made with very little reference to the fact that they were announcements for England and not for Wales. So many people in Wales get their news from London sources. There is no strong Welsh press. There's a good Welsh broadcasting system, but even then, the closer you are to the border, the more likely you are to get your news from Bristol or from Manchester. So there would be a direct effect of people hearing these announcements made by the UK government and thinking that it meant them in Wales. So there's that very direct decision. And then there is the fact that had we known about it and had we had a chance to be part of the decision making, then had we chosen to do it at the same time, which we might have done in that context, then there would have been practical things that we would need to have done, putting face masks in NHS facilities in that way in place. You've got to make sure that there's a supply, you've got to make sure that they arrive in the right place and so on. So there are intensely practical implications that we might have been able to navigate together had the opportunity come our way.
You say in this letter, I think it's the same page we're looking at, but the last paragraph and slightly over the page, you say that without a predictable rhythm of engagement, it is not credible for you to continue to defend the four nations approach as you had done consistently until now. At the time of writing this letter, did you consider that the UK government had effectively given up on a four nations approach to the COVID response?
I don't want to say that because that implies that there's a sort of monolithic view of the world by the UK government. They were parts of the UK government that I think were very keen to maintain a four-nation approach and worked quite hard to do it. What we now lacked was an impetus from the centre of government to sustain that four-nation approach. The machinery had been eroded and withdrawn, and too many decisions were being announced, which applied only to England, without any prior notice or opportunity to engage in that decision. And I would be very regularly asked in press conferences about consistency in four nations approach, and I always wanted to argue for it because that was always my preference. But I was explaining to Mr. Gove that was getting harder and harder when I would be confronted all the time with practical examples of where the UK government was not acting in that way.
You received a letter from Mr. Gove on the 22nd of July, so some 6 weeks after you'd written that letter we've just looked at. Don't need to see a copy of that response. Mr. Gove agreed with you that regular engagement between the UK government and the devolved administrations is crucial. Did you see any marked improvement in engagement after this point? So this is 22nd of July 2020. Well,
it's a characteristically emollient reply from Mr. Gove, and contact through him, and in the way we've described during the morning, is a much better part of the landscape. There is no resumption of contact at prime ministerial level. So again, I want to give proper credit to the things that did work, while just arguing that they weren't necessary, but they weren't sufficient.
You were present at some of the discussions that took place when they took place, prime ministerial, first minister level. To what extent do you think certain personality clashes, about which I've heard, might have affected the attitude of the UK government to these meetings?
I should say, my lady, that I had the highest regard for the First Minister of Scotland and the First Minister and Deputy First Minister of Northern Ireland. They were never anything but collegiate people. They took phone calls, they were involved in discussions. I had a very high regard for them all. The UK government was always anxious about their interactions with the First Minister of Scotland, because she did have a different underlying ambition for the future of Scotland, and that coloured their attitude towards her. She was also a formidable politician, and many UK ministers were afraid of her and would rather not have been engaged in a confrontational dialogue with her. That wasn't true of the Prime Minister. He was happy to talk to anybody, and I don't think he avoided discussions for that reason. He avoided them because he did not want to give the impression that the Prime Minister of the United Kingdom was somehow on a par with First Ministers of other nations. It was the optics that he objected to, I think, rather than the personality.
Between writing your letter that we've looked at on the 11th of June and receiving the response from Mr Gove on the 22nd of July, you had a call with Mr Gove on the 23rd of June. Again, we don't need to display the note of that call. Mr Gove reported on decisions that were made before the UK government cabinet that afternoon, and one of those decisions was whether to relax the 2-metre social distancing rule. And you've commented, Mr Drakeford, in your witness statement in Module 2, paragraph 109, you say that the underlying advice had not been shared with the devolved administrations prior to that morning, and there had been no consultation with us. Surely whether or not to relax the social distancing rule was a matter for the Welsh Government. Did you really need to have been consulted first by the UK Government before you can take that decision for yourselves?
I don't think that's the point I was making in what you read out, Mr Poole. I was being asked to agree in that meeting to do the same in Wales as the UK Government had decided to do in England. But I got no evidence to help me to make that decision. I'm told what the UK Government is going to decide for England, and the implication, the invitation is clearly there to do the same. But without being able to understand what lies behind the decision that's been taken in England, I'm simply not in a position to go along with it. When we did investigate it, we found that we didn't find the evidence compelling, and our contract, particularly through our Social Partnership Council, which I don't think I have mentioned, but was such a powerful part of our landscape in Wales, the Social Partnership Council were very clear that they wished to see the 2-metre social distancing rules in Wales continue, and that's what we decided to do.
If we move on to some questions now about face masks. The UK Government made it mandatory from the 15th of June to wear face masks on public transport, with the exception of people with certain conditions, disabled people and children under the age of 11. The UK Government made the wearing of face masks mandatory in shops and supermarkets then a bit later on the 24th of July. And you've said in your evidence that face coverings were the subject of, you say, regular and probing consideration. The scientific and medical advice was always contested. And then you say, and it's paragraph 209 of your witness statement for this module, that you set the bar high against a pick and mix approach to scientific and medical advice. And you say, while Cabinet remained the final decision maker, it could not be on the basis of selective adherence to the most authoritative advice available. And I think this goes back to an answer you gave this morning. When there were finely balanced scientific and medical arguments for and against a certain MPI, in this example, face masks, how would Cabinet decide?
Well, our Cabinet would be influenced by a range of different considerations. Fundamentally here, the Chief Medical Officer of Wales advised us very regularly not to put the weight of the Welsh Government behind the wearing of face masks. He says in his witness statement to you that there were only 2 examples in the whole of the pandemic where the views of ministers and the views of the Chief Medical Officer differed, and this is the most important one of them. And maybe if I could make one slightly wider point, but it's relevant to this. One of the big differences between being a minister in Wales and being a minister in England, but in Scotland as well, is that we don't live separate lives. The First Minister of Scotland spent the pandemic in Bute House, in her official residence. We have no such thing. we are directly engaged with the mood of the people. I remember very vividly, if I could say, the week after the pandemic, we made the decision, we need food at home. My wife and my mother-in-law are shielding. I am the only person in our house who can go shopping. So I leave the government building in Cathays and I go a few hundred yards away to a Lidl, and I join the queue outside. And it's beautiful, the weather is beautiful, and people are standing outside at a 2-metre distance. I find myself standing behind somebody I already know. And lo and behold, the person who comes after me is somebody else that I know. And I am observing the extent to which people are already wearing face coverings of their own volition in those more risky situations. And so when Welsh ministers debated, as I said we did, very much with the Chief Medical Officer, whether this was the right advice to give, we're drawing on our own lived experience of seeing the way our fellow citizens are behaving in these extraordinary circumstances and worrying about the gap between the advice that we are given and we are giving and people's own conclusions that they're drawing in their own lives. In the end, and it does, as you say, take me back to the point we debated a little before the break, the Chief Medical Officer's view is very clear. Advising face coverings is not only of marginal utility, but could positively harm the efforts that people are making, because it would lead them to do more risky things in the belief that they were protected from those risky things by wearing a face covering. And in the end, as I say, we don't pick and choose. We follow the advice that we're given. And
it would be right to say we know that Dr. Atherton remained at the sceptical end of the spectrum of opinion in respect to face coverings. His advice was always explicitly against making them mandatory. And you say in your witness statement, you felt it important to support that position. Why?
Because of the arguments I made this morning. Imagine if we had decided to go against the advice of the Chief Medical Officer, advice that would be publicly available. Everybody would see the Chief Medical Officer has advised this and you have done something different. The following day, I would go to the Social Partnership Council and I would be in a difficult conversation with tourism interests in Wales. And I would be explaining to them, I'm afraid we have to do this because the advice we have is that is important. What would their first answer to me be? Well, you ignore the Chief Medical Officer in his advice on face coverings, so why do you feel you've got to follow his advice on this? And that was not a line of argument that I felt it was in anybody's interest to open up.
But you could have justified it. If you felt that it was sensible to take the advice in one example, but not another, couldn't you just have said to your Partnership Council, well, in this respect, I have huge amount of time for Dr. Atherton, but I happen to disagree with him, and I've looked at all the evidence, and I've seen what other countries are doing, and because we're trying to be cautious in Wales, I'm going to go this way. Couldn't you have done that?
I could have done. Absolutely, I could have done. It would have undermined the Chief Medical Officer. I think in the eyes of people who had known that the Welsh Government had seen his advice and decided they didn't want to follow it, that would have given his advice in other contexts less weight and it would have been more vulnerable. And we were constantly being asked by different groups to make an exception for them. They could see why it was necessary for us to do this, but couldn't we see that they, whatever it would be, and there's a very long list of them, need to be treated differently? And my strongest defence always was that the advice we had was that we needed to act in the way that we did. And I absolutely agree that the choice was there, but the choice I made and my colleagues made was not to create a chink in the wall of the argument that we were making.
But aren't you then slavishly following the science, which this morning you said you weren't doing, you were being guided by it? But if you always follow it, aren't you slavishly following it?
Well, I don't think we were slavishly following it because, as the extract said, we were in vigorous discussion with the Chief Medical Officer on this point and testing him and asking him things like that. In the end, his professional assessment was always clear. You can do it, but you'll be doing more harm than good. And I don't think that was a position my ministers would have willingly put themselves in.
What about consistency of messaging? Was there not an argument, and quite a powerful argument, for charting the same course as England and Scotland, just to ensure a consistency of messaging on face masks?
Yes, there was, and I'm absolutely certain those points were made in the discussion we would have had.
There's a Covid-19 core group meeting of the 14th of July. Don't need to display the minutes, but it was noted that there'd been a great deal of coverage in the media about the use of face coverings, and in short, the public were questioning why it wasn't mandatory to wear face coverings on public transport. Face coverings were made compulsory on public transport in Wales from the 27th of July. Was that decision influenced by public opinion?
Yes.
6 weeks after that decision had been made by the UK government, is that 6 weeks delay justifiable in your view?
I think it's explainable. I don't think it's for me to justify it, but I think I can explain it in the way that I have, is that we are we come back to this topic, far more often than maybe the significance of the wearing of a face mask justified, but we come back to it very regularly because of the public interest in it, because we can see that people in Wales are acting in a way that's not consistent with the advice that we are giving, and we want to test that advice regularly and probe it and challenge it and all of those things. Over time, the advice changes, and part of the reason why it changes is that it erodes confidence in some of the other things you're asking people to do if too big a gap opens up between what people are concluding in their own lives and what it is that the Welsh Government is advising them to do.
When you changed it, what was Dr. Atherton's advice at that stage?
Well, I think Dr. Atherton was always at the more sceptical.
So you didn't follow him when you changed it?
No, I think he had moved away from the argument that it would do more harm than good. He was sceptical always that it did any good, and always anxious that people would think they were protected by a face covering and therefore not observe social distancing, for example, because I've got a face mask on, it's okay. So he was always anxious about that. I think by the time we changed the advice, his feeling was, given the way that people were behaving, that while it didn't do much good, the argument that it would be positively harmful was no longer as strong as he would have articulated it at the beginning.
One of the reasons that Dr. Atherton explained in his evidence to the inquiry of his view why he was at the sceptical end, as you've just alluded to, is that it would make people complacent if they were to wear a face mask. And from what you've just said about your trip to Lidl and seeing people in the queue wearing face masks, even though it wasn't mandatory in Wales at that point, I mean, did you see evidence from England or anywhere else in the world that actually wearing face masks made people complacent, such that it might support Dr. Atherton's views?
I don't think I could say that I saw direct empirical evidence. I certainly saw Dr. Atherton's view expressed by a whole range of other scientists who also argued that there was a risk in encouraging people to wear face coverings, that it would undermine their willingness to adhere to far more effective NPIs.
The inquiry heard evidence in Module 2 from Sir Patrick Vallance, and his evidence was that there was clear advice on the benefits of face masks in June 2020, and he said anything else was politics. Did you consider that playing politics is perhaps how the different policy decisions being taken by the Welsh Government would perhaps appear to members of the public?
I don't think there's any evidence of that. Satisfaction levels with the Welsh Government and people's confidence in the advice they were given was at a very high level during all of these months. Change
topic briefly. Eat Out to Help Out. August 2020 saw the introduction of that scheme. We know, obviously, it was a scheme implemented by the UK government. We've heard, the inquiry's heard evidence that Sage wasn't consulted about the scheme, only knew about it when it was announced. And I'm right in saying there wasn't any consultation with the Welsh Government about it. Is that right?
That's right.
Were you given any opportunity to ask questions as to its scientific rationale?
We weren't offered any opportunities. And just to be clear, this was an entirely non-devolved scheme carried out by the UK government using their own reserved powers, and there would have been no receptivity at all to the Welsh Government saying, we'd like to talk to you about this, are you sure it's the right thing to do? We would, I'm absolutely certain, have been told that it was nothing to do with us, that it was a UK scheme and it was happening everywhere.
I think it's quite clear from your witness statement that had you been consulted, you would not have supported the scheme. Is that right?
I don't want to overstate it. Had we been offered the opportunity, we would have asked some fairly sceptical questions about it. But we would have weighed up the answers and the evidence that we were given. We know now that it very likely helped the spread of the virus. At the time, I don't want to go further than saying, had we had the opportunity, we would have asked some probing questions about it and would have wanted to have seen the evidence on those points for ourselves.
Change topic now and deal with the period September through to October and the Welsh fire break. You say at paragraph 215 of your witness statement for this module, when describing the use of local lockdowns to deal with local outbreaks of Covid-19 in September 2020, you described that as a failed experiment. Explain why you have said that.
Well, the pattern in Wales, my lady, is the one we've described. Things get better during the summer. And the first Sunday of July, we have the first day since March where there are no deaths from COVID. We have 11 days in a row in August when there are no deaths. Things are getting better. And the last time we have a 3-week review in August, the advice is that we can expect things to continue to be relatively benign with some warning signs about the autumn. In fact, things got worse much more quickly in September than we had anticipated. And very soon we find that there are some local areas where there is a significant upswing in the virus. So the county of Caerphilly, for example, had 1/3 of all the cases in Wales in that early period of September. And what we follow is a classic public health response to it, one I was very familiar with from my time as health minister when I dealt with outbreaks of measles in Swansea and tuberculosis in Llanelli. You find the source of it, you track, you trace, you contain, and you try and put a ring around the problem and restrain people's lives there, but don't affect people's lives where there is no virus in circulation. That's what we set off to do in September, and as I say, it's textbook public health response to an outbreak. By the time we get halfway through October, though, we have got local lockdowns over almost half or more of Wales, and every week we're having to add more local areas to. In other words, it just hasn't worked. That's what I meant by a failed experiment. I'm not saying that it didn't have an impact. I should make that clear. I think there are figures that show, for example, the county borough of Torfaen in southeast Wales, on the day that it went into lockdown, it had, in a local lockdown, it had the same level of coronavirus as the town of Bolton in England. Weeks later, the rates in Torfaen are between 50 and 60 per 100,000. And in Bolton, where there's been no restrictions, it's over 300. So I'm not saying it didn't have any impact, but what it didn't do was to contain the outbreak in that local area in the way that we had hoped.
Let's just look at the information that was coming through to the Welsh Government throughout September and into October. If we start on the 15th of September, there's a daily ministerial call. You received an update from Mr. Gethin. We don't need to go to the minutes of it. There's a TAC report, was that Wales was in an equivalent position to early February. The R rate was above 1. Urgent decisions needed to be made as to whether to persist with the local lockdowns or take national measures. And then on the 18th of September, 3 days later, TAC advised that more needed to be done to bring the R rate back below 1. So in summary, again, the TAC advice was a package of MPIs may be needed to bring R below 1, and that action would be most effective if implemented early. And we know that a circuit breaker or fire break lockdown was recommended by SAGE on the 21st of September. Perhaps if we just have a look at the minutes. Fliss Bene attended on behalf of TAC, their INQ 4061566. And I'm looking at page 2, paragraph 2, please. Thank you. SAGE advice, package of interventions would need to be adopted to reverse the exponential rise in cases. Single interventions by themselves unlikely to bring R below 1. Top of the list of interventions, we see there circuit breaker to return incidence to low levels. So this is 21st of September 2020. And then if we can look at paragraph 6 on that same page, please. The more rapidly interventions are put in place and the more stringent they are, the faster the reduction in incidence and prevalence, greater the reduction in COVID-related deaths, to which high confidence both local and national measures are needed. Measures should not be applied in too specific a geographical area. Just continuing, so we know what the information was that you had 4 days later, 25th of September. We can take these minutes down, thank you. The need for early intervention is reiterated by TAC. Again, don't need to go to the advice. It was that if current measures do not bring R below 1, further restrictions will be needed to control the epidemic in Wales. And then a week later, on the 2nd of October, a rather more stark warning from TAC. Unless measures bring R below 1, it is possible that infection incidence and hospital admissions may exceed scenario planning levels. So the advice seems to be pretty clear, certainly from SAGE on the 21st of September, and then reinforced by TAC and TAG, that immediate steps such as a circuit breaker are needed, and that they would be most effective if introduced early. So at this point, we're now beginning of October. What is the Welsh Government's thinking as regards a circuit breaker?
Well, the Welsh Government took the advice very seriously. You'll know that I raised it at COBRA meetings. The Prime Minister told me he wasn't prepared to introduce a national lockdown. I asked for a special meeting of COBRA to consider the circuit breaker advice. I was supported by that, by the First Minister of Scotland, but that meeting never took place. There are a series of headwinds to the Welsh Government being able to act on that advice. There are financial headwinds to it. There are political headwinds to it, given the Prime Minister is not just not prepared to do it, he's actively opposed to doing it and says so publicly and criticises the Welsh Government when we say that we are intending to do so. I think Professor Dan Wincott says in his advice to the inquiry that decisions in Wales are often made in the shadow of decisions that are made by our next door, much bigger next door neighbour. And I want just to underline the headwind that does create when you are trying to do something in the face of active opposition from others. There is acceptability to the public. We're 4 weeks on from the summer holidays. Only 4 weeks ago, people are on the beach and things look like they are much better. 4 weeks later, to say to people that they're heading into a national lockdown, there are real concerns in my mind about being able to persuade people of that. And then there is the balance of harms, which we are more aware of in the lead up to the lockdown period, the circuit breaker period, than we were back in March. We're now more aware of the other things that we have to balance. So we spend October trying to grapple with those things and to come to a decision that balances the advice we are very clearly getting from SAGE and increasingly getting from Welsh sources, with all the other things we have to take into account.
So let's just look at you mentioned two headwinds, a political headwind and the economic headwind. And you mentioned the Cobra meeting. I think the Cobra meeting was on the 12th of October. We don't need to bring up we've got the minutes, so why don't we look at them as they're there? Thank you very much. INQ 4083851, page 7, paragraph 11. You asked the Prime Minister whether a circuit breaker or a fire break lockdown would be considered, as had been advised by SAGE. And I think, talking about a political headwind, you had formed the view, had you not, even at this relatively early stage in October, that the UK government were not with you on the need for a fire break lockdown. Is that right?
Well, I had formed that. It's there in the minutes. I don't want to over-rely on Mr. Dominic Cummings's evidence, but this is what he says about the Prime Minister's attitude at this point. Enraged, the Prime Minister made his comment, "No more expletive lockdowns, let the bodies pile high in their thousands." Now, I don't over-rely on that, but it does give you a sense of, it's not just the UK government is not convinced or is neutral about it. They are positively determined not to do what they're being advised to do, and positively going to oppose Welsh efforts to do what we thought we needed to do.
Was, of course, the evidence of Mr. Cummings.
I hope I've caveated my reliance on it.
Following this Cobra meeting of the 12th of October, you updated Welsh ministers as to what had been discussed at this meeting. That was on a daily ministerial call of the 13th of October. Again, we don't need the note of that meeting, but it records your recollection of the Cobra meeting. The UK CSA and CMO repeatedly telling the Prime Minister that Tier 3 measures would not be enough to reduce the R rate below 1, but that a circuit breaker would. And it's at this point, 13th of October, that you invited Welsh ministers to consider a circuit breaker. And it's recorded in the minutes. Dr. Atherton informed the meeting that the 4 CMOs of the UK supported a circuit breaker. Public Health Wales, TAC and SAGE all agreed that that was the right approach. So at this point in time, we've seen SAGE advice going back to the 21st of September, talking about a circuit breaker. Would I be right in understanding that as of 13th of October, no plans had been put in place by the Welsh Government for the introduction of a circuit breaker?
Well, that is a decision in principle. So it's not a decision about the detailed planning. First of all, I need to know whether this is a course of action that the Cabinet are prepared to embark upon. So we do have a very detailed debate, and at the end of it, there is a unanimous agreement that despite those headwinds that I've outlined, this is the right thing to do, and we make that in principle decision that will be our policy.
And I think it's right to say, also on the 13th of October, you wrote to the Prime Minister, you raised an issue about the English-Welsh border that we might come back to, about those moving from high prevalence areas to low prevalence areas. But at the end of that letter, we don't need this brought up. You invite the Prime Minister to convene a Cobra meeting to discuss a UK-wide circuit breaker. So although you say on the 12th of October at Cobra you had formed the view that this was not something that the UK government or the Prime Minister was ever going to countenance, you seem to still be writing on the following day, on the 13th of October, inviting a meeting to discuss it. Why?
Because I thought the Prime Minister's approach on the 12th of October was extraordinary. It is very unusual for very senior civil servants to be as blunt with the Prime Minister as both Sir Chris Whitty and Sir Patrick Vallance were in that meeting. They both repeatedly said to him, your plan for Tier 3 lockdowns will not bring the R rate below 1. And it's rare for advice to begin as bluntly as that and to be repeated during a meeting in that way. So I wanted the Prime Minister to have another opportunity to reflect on that advice and that evidence. And in a meeting where we weren't talking about lots of other things, but where we had as the sole purpose of the meeting the advice we had from SAGE, the advice we were hearing from senior advisors. And I would not have given up hope at all that if we'd done it, we might yet have come to a greater consensus about the need to act in line with the advice we were receiving.
We've addressed the political headwind that you say the Welsh Government faced, dealing next to them with the economic headwind. I think you say that had you the confidence that the UK Government would provide the money needed to support people during the firebreak, you would have probably implemented the lockdown sooner. That's right, is it?
It is.
Just exploring that with you, if I may. The job support scheme was announced on the 9th of October. And Mr Sunak has said that he confirmed that the date of the 1st of November could not be brought forward prior to that announcement on the 9th of October. I suppose first, is that right? Do you agree that you knew that the date of the 1st of November was not a movable feast?
I would have known that that is what the Chancellor of the Exchequer had said. Didn't mean that I necessarily agreed with him.
You wrote to him on the 16th of October. If we can have a look at that letter, please. It's INQ 302165554. The first paragraph, you tell Mr Sunak that the Welsh Government is actively considering introducing a Welsh circuit breaker and that the plan is that it would run from the 23rd of October to the 9th of October. I think that is captured in the next paragraph. But if we can turn over, please, to page 2 and look at the third bullet point, you say that HMRC could administer a scheme of this sort given the systems put in place, and you then say that the Welsh Government would be willing to reimburse HMRC for the additional costs of paying 67% of the wage costs of eligible employees instead of 60%. So that's your letter of the 16th of October. Chancellor's response, or then Chancellor's response, if we can see that, please. It's INQ 302165555. And it's the first main paragraph, effectively saying unable to bring forward the claims date to the 23rd of October due to limitations in HMRC delivery timelines. Now, it's fair to say that you were deeply disappointed with this response, and you said as much in your letter back to the then Chancellor of the 20th of October. Returning, though, to the point you make about the timing being tied up with or influenced by UK Government financial support, your first letter is the 16th of October. That's a week before the firebreak was to come into effect. You knew prior to the JSS announcement on the 9th of October that the 1st of November had been effectively a date set in stone by the then Chancellor. Why were you not making these inquiries much earlier, especially given the SAGE advice in mid-September?
Well, I think the facts are that I was raising it much earlier. The first time I raised it is on the 22nd of September in a COBRA meeting where I make a point. There's a huge amount of very knotty detail in this issue, but there's a very simple principle behind it, which is that if the public health circumstances in any part of the United Kingdom were such that action needed to be taken, there needed to be a process in which the Treasury could be asked to support that action. It was never my proposition, nor indeed the proposition of the First Ministers of Northern Ireland, Scotland, that it would simply be a matter of us saying, please send us however many pounds, and it would follow. We wanted a process that we would all agree on, whether First Minister of Northern Ireland would say, things are so bad in Northern Ireland at the moment, I need to take this action. Will I have the financial support needed to allow me to go ahead? And that's what I was looking for from as early as the 22nd of September, a recognition that any part of the United Kingdom could have a call on Treasury support where it could be demonstrated that that support was needed. And after that, that is what I'm pursuing all the time here. Here is a letter from the Chancellor that tells me it can't be done practically. Of course, he was able to do it practically as soon as England asked him to do it. So there's a little bit of a gap between what he's saying to me. He had no more time to change his plans for England when they asked him than I was asking him in Wales. As you know, there is a document that I would like to draw attention to if I could, because I think the Chancellor's reply offers half of the reason that he had rather than the whole of the reason.
Yes, and just for the record, so we can see it there displayed, it's INQ 000397193.
So I asked if I could draw attention to this, my lady, because I hadn't seen this document until Friday of last week. It's a debate between officials in the Treasury as to how they should respond to the request that I have made. And you will see that there are two reasons why the request was turned down. There is the practical reason. They continue to identify that in here, but they say that there is a policy of the UK government not to support the devolved administrations going further than the UK government on NPIs. So it is the policy position of the UK government that devolved administrations are never to be offered more help than has already been offered to England.
Sorry, where do I find that, Mr.
You would
Whitford?
find that it's under handling advice, and it's in the second line. The point we previously discussed about DAs going further than HMG on NPIs. My request, they say, is not possible and goes to the point we previously discussed. And they say in the first paragraph that that is a matter of policy. A policy
I'm
of the
not
Treasury.
sure I'm reading it exactly that way.
Well,
Wait a minute. So they're basically, in the first paragraph, we have two reasons, a matter of delivery, which we know about, as well as policy. Well, policy there could mean policy to do with whether or not they should all apply to the United Kingdom and when, or the fact is going to apply to the whole of the United Kingdom and when. Policy doesn't necessarily mean, it could be all sorts of things, couldn't it? Does not necessarily relations with devolved nations. So then we come to, and anyway, furlough carries on to the end of October, which I suspect a point Mr. Paul was about to come to. Then handling advice, we've had the attached letter, can't bring it forward. As you know, this is not possible, bringing it forward. And anyway goes to the point we previously discussed about DAs going further.
so I believe that that is a statement of their policy, the policy they refer to in the first paragraph, which is that they have made a decision that we will not get any more help than has already been provided to England. None of that appears in the Chancellor's letter. The only point he relies upon is the practical point. But you will see in point 2 of the handling that this is a relatively cynical decision to put pressure back on the First Minister. Will he go ahead with the actions that I am explaining are necessary to protect public health and prevent people dying in Wales, knowing that we, the Treasury, won't bail it out? That is the recommended option. This is put to the Chancellor of the Exchequer. This is not just junior officials debating amongst themselves. This advice is put in front of the Chancellor of the Exchequer, and he agrees it. I think my only point is that in public, the Chancellor relied on, it's just not practical for me to do it. Although, as I say, it turned out to be practical only a few days later. Whereas, in fact, it was more than just practical objections. There was a policy position in the Treasury not to support the devolved governments, even when we needed it.
I see that's your reading. I'm not quite sure I read it the same way, but maybe it's open for discussion for which we do not have enough time. So I apologise for entering into the debate.
My lady, not at all. And I think it's only fair to say that the then Chancellor, I think when the relevant passage of your witness statement, which you've just elaborated on orally, was put to him in Module 2. I think his answer was twofold. I think he first of all pointed to the fact that furlough ran until the end of October, but he also pointed, as well as to the Barnett consequentials, he said the upfront funding guarantee that the UK government introduced in July 2020, which he said provided an extra £5 billion for Wales and provided Welsh Government with extra financial flexibility and security. So in other words, he said a significant sum of money was made available to Wales in advance of need. Is that an answer to the point you make about timing of the firebreak?
Absolutely not. And in fact, in the additional statement that Mr Sunak has provided you, he doesn't mention that because he realises that that was not actually available. The money that comes in the Barnett Guarantee, for which we were very grateful. And I should again just say, time and time again, I tried to say how much I appreciated the enormous efforts that the Treasury did make in many of the schemes that they put forward, and the Barnett Guarantee was a very helpful thing for us. But the Barnett Guarantee money was to be spent on devolved responsibilities only. We could not have used it to spend on schemes for which only the Treasury had the responsibility. So although the Chancellor said that in his oral evidence, in his follow-up written evidence, he retreats from that completely.
Mr Lockwood, I'm sorry, I'm going to enter the debate again, having told myself not to. What I don't understand is this. I have heard a number of representatives of the Welsh Government basically blame the UK Government for a delay in bringing into existence the firebreak on the basis that the delay was really caused by their refusing to give you the financial backing you needed. Then yesterday we were discussing this matter with Ms Mason, and she explained, when pressed, that in fact the furlough scheme was going to keep going till the day before the new scheme came into force, and therefore you had the financial backing. It's just that the new scheme would have provided greater financial backing. So I'm sorry, I don't understand the argument, and I'm happy for you to explain it if you can, as to how the Welsh Government can blame the UK Government when there was financial backing in existence. It just wasn't as much.
I'll do my best to explain, because I think there are two reasons why that argument would not have been sufficient for us at the time. First of all, it would have required every business in Wales who was now going to have to furlough somebody because they would no longer be able to operate, to apply for one scheme for week 1 and then a wholly new scheme for week 2. We thought that was not a reasonable burden to put on businesses and employees when it could be avoided. But the second and the more important reason is that the qualifying criteria for the two schemes was very different. And the qualifying criteria for the first week was much more restrictive than it would have been for the enhanced job support scheme. So not only would people have had to have applied twice, but far fewer people would have been successful in those applications in the first week than would have been true in the second week. And the reason the Chancellor had put in a new scheme and a more generous scheme was to recognise the gathering difficulties of COVID's new sweep up through the autumn. So not only would it been difficult to do it practically, but actually it wouldn't have delivered for very many people. Anybody working in hospitality would not have qualified for the first week of help at all. So we would be saying to people in Wales, you're not allowed to go to work and there's no help for you at all. All of that could have been put right by the UK government by simply adjusting 1 week in the introduction of the scheme. And we were prepared to recognise that there would be additional costs for them in doing that, and we would have paid for them out of our own resources. The UK government wasn't prepared to do that.
So I understand that you'd have much preferred it to come in and that you made your contribution offer. What I don't follow is if on one side of the argument or one side of the equation you have the health of your nation and the possibility of many more infections and many more deaths, and the fact you've come to the conclusion you have no alternative but to lockdown. And on the other hand, some difficulties which I accept would not be easy for employers and certainly wouldn't be easy for people in hospitality. But I don't see how those two end up with your being able to blame the UK government for a delay in the firebreak.
Well, what I'm arguing for is a level playing field. When UK ministers go to the Treasury and say, things are so bad, we need you to change the scheme is changed immediately. When Welsh Government goes to...
So what was the example of that? I'm sorry, I meant to ask you. What was the example?
Well, because within a couple of weeks of our firebreak, England is in a 4-week lockdown.
But did they bring forward any scheme then? I'm not following why you said they were able to bring forward schemes.
Yeah, I'm sorry, it is fiendishly complex in the detail. The Chancellor of the Exchequer changes his plans at that point. He doesn't move from one scheme to another. He rolls forward the first scheme for another month to accommodate the changing circumstances in England. It really is as simple as this. When English ministers ask him for help, he says yes. When Welsh ministers ask him for help, he says no. And that's not fair. That is the Treasury not operating as a UK Treasury. It's operating as the Treasury for England. And that's why this was such, I think I say in my evidence, this was one of the, for somebody who believes in the United Kingdom, this was one of the hardest moments in the whole of the firebreak, because we were not being treated fairly. We were not being treated as we would have been had we been English ministers asking for that help.
Mr. Drakeford, just before we take a break, try and finish this topic of the firebreak, and circling back round to timing. It was the 14th of October that the firebreak implementation group was established. There was then an emergency cabinet meeting of the 15th of October. We don't need to look at those minutes. The scientific advice was that a minimum 2-week lockdown was required, but it was said that 3 weeks was preferable. I suppose just pausing there, if you're being told that the 3-week firebreak was preferable, why was it ultimately decided to go with a 2-week firebreak?
Well, it wasn't a 2-week firebreak. It was
Three
a 17-day.
3 weekends, 2 weeks.
Yeah, indeed. So it was a 17-day firebreak, and there's a trade-off here between length and depth. The advice we're getting is you can either go longer and have more shallow restrictions. The shorter the firebreak, the deeper it has to be. And the Welsh Government decides to have a 17-day firebreak and to have it as sharp as we can make it. So every time you will see in the papers, there are a series of choices ministers are asked to make between more intense restrictions or less intense restrictions, and every time we decide on more intense restrictions because we have got fewer days of those restrictions in place. So it's the balance between length and depth, and we resolve it in that way.
The emergency cabinet on the 15th of October makes an in-principle decision. That's to have a firebreak. That's not formally approved until Cabinet then meets again until on the 19th of October. Why does it take a further 4 days to formally make a decision that's already been made in principle?
Well, it's because of the way in which we made decisions in Wales, which I think, if I could sum them up, the process was exhaustive and exhausting, because my aim was to make sure that we involved as many voices as we could in these difficult decisions. My lady, I can say to you, from my experience, the easy way for a government to ask is to ask as few people as you can get away with. Our objective was to do the opposite. We aimed to talk to as many people as we could about the impact of our decisions would have on them. So in this period, the Cabinet is meeting daily, sometimes twice daily. We are also meeting the Social Partnership Council. We are consulting with the Children's Commissioner. My colleagues are talking with all their sector organisations. From a minister's point of view, as I say, that's an exhausting way to make decisions, and it makes the burden of decision making more difficult in some ways, because now you have to take into account all the difficulties that everybody will have explained to you that this is going to mean for them, and that does take a couple of days to do it. But my aim throughout the whole of the pandemic was to never come to a final decision unless I felt that we'd had every opportunity to listen to people in Wales and their representative organisations, and for every question that any one of my ministerial colleagues that they wanted to raise, that they'd had the opportunity to raise it. And that does take a couple of days, and that's what was going on in the days between the 15th and the 19th of October, that intensive work of engagement with people about the major decision we were about to take.
We now know that the second wave had a greater impact in Wales than the first. More lives were lost. Do you consider that different decisions should have been taken throughout September and October, and ultimately should a firebreak have been brought in sooner and for longer?
Well, I said to you that the firebreak decision was about balancing the four harms. And the harm that is most in the minds, other than the harm from the virus itself, in our minds at this point, is the harm to children. We had agreed as a cabinet that keeping schools open would be our top priority. The schools would be the last to close. And we were very committed to making sure that a week of the firebreak coincided with half term in order to minimise the impact on children's lives. So there's obviously a very plausible argument that you could have brought it forward a week and still had a week of half term in it. But it's the process of weighing up all those different harms that leads us to the timetable we eventually adopt. It's not the only timetable. I'm not defending it, I'm explaining it as best I can. And that's one of the driving considerations for us at this point, is trying to minimise the impact of what we're about to do in the lives of children who have already had their education significantly disrupted in Wales.
My lady, if that's an appropriate point.
Yes, of course. 3:15, please.
All rise.
Mr. Hall.
Thank you, my lady. As you came to the end of November 2020, Mr. Drake, for detention turned to the approach to adopt over the Christmas period, and it was recognised that, if possible, there should be a four-nation position on what was and what was not going to be allowed over Christmas. If we can have a look at a COBRA meeting minutes of the 24th of November, please. INQ 40838850. If we have a look at page 6, paragraph 4, please. Dr. Atherton is noted as saying relaxing the rules for winter festivities would bring a cost to it. Paragraph 6 on the same page, Christmas proposal was put together as there was a significant risk of non-compliance otherwise, and it allowed the public to come together when needed in a more managed way. Para 7, please. The proposal was for up to 3 households to come together in an exclusive bubble, with the 4 nations being able to define households slightly differently. And then if we go to page 7, please, para 10, you are noted as agreeing to the top messages of the proposal and would need to ensure clarity of public messaging. Now, one of the concerns that was voiced at COBRA was that Wales was the only nation at this stage without a tier system, and so needed to give thought to what to revert to after the 27th of December. Do you consider a tier system ought to have been introduced earlier than the 4th of December, as it had been in the other 3 nations?
I don't think so. At this point, we have our own method of responding in Wales, and I don't think I felt under any pressure just to come into line with what others were doing.
Now, we know that a new variant of the virus had been identified that spread very quickly, and on the 16th of December, you announced that Wales would move into alert level 4, so the highest level, effectively lockdown from Christmas Day, and that a smaller Christmas is a safer Christmas. Mr. Gething told the inquiry in his evidence on Monday that by the 15th of December, it was his view that there was a clear rationale to move ahead of the agreement that you had reached with the other nations of the UK. He told us that Cabinet was split. You set out a case for a different course of action, namely delaying further restrictions. My question is simply this: given you and Mr. Gethin were drawing on the same scientific evidence, including Dr. Atherton's advice, why were you and Mr. Gethin on different pages, it seems, regarding the timing of a Christmas lockdown at this point?
Well, this was the most difficult period of decision-making in the whole of the pandemic for the Welsh Government. The Health Minister was in receipt of direct advice from the Director General of the NHS about the risk to the health service and from the Chief Medical Officer about the continuing rise in infections in Wales. I am concerned about the other harms that would occur if we were to bring forward a lockdown to the pre-Christmas period instead of the immediately post-Christmas period that we have identified. And I'm anxious about that for a string of different reasons. I'm anxious for businesses because many businesses make their, the difference between them surviving and going under is the week before Christmas. That's when they make money, and we have promised them that they will have that week to trade. There are many people in Wales, my lady, weekly paid people, who only buy Christmas presents in the week before Christmas because they're not able to manage money in a different way. They rely on that final pay packet, and then they go and make Christmas. And we're about to take that away from them. And even more so, I am very heavily, weighing very heavily with me, is the impact on children. In my own constituency, I have a school which has one of the largest proportions of children on the at-risk register of any school in Wales. It's a fantastic school. Their teacher sets off at 8 o'clock in the morning to go and collect children whose parents otherwise wouldn't manage to get them ready to get to school. If those children have a Christmas, they have it in school. If they have a Christmas present, it's because the school gives it to them. If they have a Christmas party, it's because it happens in school. If they have a Christmas dinner, it's because the school provides it in that final week. They're not going to get it at home. And we're about to say to them that their Christmas is completely cancelled. And, I think I am lucky that I don't have many sleepless nights, even in these difficult days. But at that moment, I am really worrying about what we are faced with deciding. We have a cabinet meeting. The cabinet is evenly divided between whether to bring forward the restrictions or to stick with our original plan. Although I had approached it from a different starting point than the Health Minister, of course I sum up at the end of the meeting in favour of his position, not mine. And the reason for that is a point, my lady, I think you made earlier. And it's why, in the end, some of what looked like really difficult decisions, I thought were resolvable. Because the advice we are having from our medical colleagues is that if we don't act now, people who otherwise would be alive would lose their lives. And although a child in school, if we close them early, they will be losing their education, and in some children's cases, they will be losing an awful lot more than that. In the end, they will get Christmas back another year, and we can do things to restore their education. I cannot give them back their nan. And so in the end, for me, the decision was never that difficult. If you have advice that says you need to do this or lives will be lost, despite the other harms, that's the way in which the Welsh Government resolved the decision. And in that meeting, where that is the very dilemma we were faced with, although I had started from a different place to the Health Minister, I resolved the discussion in favour of the arguments he was making for exactly that reason.
And we don't need to go to the minutes, but just for the record, that was a Cabinet meeting on Saturday, the 19th of December. It's INQ 4048803. And the decision, as you said, Mr. Drakewood, was to bring forward alert level 4 restrictions for the whole of Wales from midnight that night. Want to just go back to schools and education in this pre-Christmas period briefly. Because on the 2nd of December, there was a draft tag paper titled Statement on MPIs in the Pre-Christmas Period. If we can have a look at that, it's INQ 30350039. If we can turn to page 7, please, second paragraph. The available evidence indicates that schools being open is associated with higher rates of infection in the population, although there is no clear evidence of a causative relationship. If we can have a look at page 12, please. Under the schools policy option, this provides modelled estimates of the impact of schools moving to blended learning from 14 to 18. And if we just turn over the page to 13 and look at the table, this sets out the difference in outcomes using different reproduction rates between schools being open and closed. And we can see that the difference is reasonably sizable. Miss Kirsty Williams, set out her thoughts on this TAC paper in an email to the Minister for Health and Social Services and your special advisors and your private office. If we can have a look at the email, it's the 6th of December. It's INQ 30350044. Third paragraph, she explains that the paper, so namely the draft TAG paper we've just looked at, is deeply difficult for education. And then in the next paragraph, the fourth paragraph, that it is contrary to the agreed position of the government that education is a priority. And it is right, isn't it, that as a result of Miss Williams's concerns, you asked for the paper to be held back from publication, and an updated paper was published on the 7th of December. Before we just look at that updated paper, I've got everything right so far?
Correct.
That updated paper is INQ 30350057. And if we look at the modelling charts, they're pages 12 and 13, please. Just having in mind what we saw earlier, the section setting out the differentials in impact when schools are closed has been removed from this published paper, as has the suggestion that schools move to blended learning from the 14th to 18th of December. Why did you consider that the TAG paper should be amended in this way?
Because I agreed with the Education Minister that there had been insufficient discussion with her and her advisors about the content of the paper. She wished to interrogate that data further. She wanted more discussions with the authors of the paper to understand the basis on which this advice, which was contrary to, as she said, the position that we had aimed to sustain up until that point. Before that information went into the public domain, I wanted to be sure that my Education Minister was confident in it, and she clearly wasn't confident. Felt she hadn't had the opportunities that she needed. I didn't want to hold the paper up longer than was necessary, so the paper was published, but it allowed discussions with the Education Minister and her advisors to go ahead.
I understand. As we entered 2021, cases remained very high in most parts of Wales. There were rapid increases in North East Wales in particular. So despite the Christmas restrictions, the new strain of the virus appeared to be driving an increase in cases. 4th of January, all 4 CMOs for the 4 nations recommended that the UK alert level move from level 4 to level 5. And we don't need to go to the minutes, but that was discussed in a 4-nation call with Mr. Gove. And in summary, the decision was made that measures would remain in place until the 15th of February with no review before then. That's right, isn't it?
Yes.
Want to again just look briefly at decisions that were made in respect of schools in this period in early 2021. If we can see a TAG paper, published paper, 7th of January, it's INQ 4066357. If we can have a look at page 6, please. Under the heading Education and Schools, I think it's about 6 lines down, it starts slightly indented. It is difficult to quantify the size of this effect, and it remains difficult to quantify the level of transmission taking place specifically within schools compared to other settings. Open schools also being associated with adults attending work, more travel and commuting, and schools' day wraparound community and sport activities in the end-to-end day. If we can turn to page 8, please. Second paragraph. Pattern of confirmed cases and clusters of cases associated with schools in Wales reported by Public Health Wales during the autumn term did not indicate a large proportion of transmission associated with schools. And then over the page, page 9, please. ONS CIS data from 2nd of September to 16th of October show no evidence of difference in the rates of teachers, education workers in England testing positive compared to key workers and other professionals, medium confidence. And then finally, over page 11, please, second paragraph. Schools should not be disproportionately used as a control measure for reducing rate, particularly if existing non-pharmaceutical interventions are not being observed as well as they could be, e.g. indoor mixing. The aim to maintain schools' operations to minimise avoidable harm to children would be accompanied by a clear communication strategy that there should be no wider relaxation of precautions. Ms Williams, in her witness statement to this module, when discussing this paper, she says it was discussed in a ministerial call on the 7th of January 2021, and it was decided that schools could not fully reopen on the 18th of January, and that it was unlikely that schools would return to face-to-face teaching before the half-term in mid-February. Why was this decision taken, given the advice and the evidence set out in this TAG report?
Well, first of all, Mr. Poole, I think in the extracts you've highlighted, you see the complexity of the advice in this area and its inconsistency. You know, it was never that we had a definitive set of information about the impact that schools had on transmission, the difference between different age groups, the effect of parents congregating at the school gate. You know, at different points, the advice pushed you in different directions, and although this advice would be very consistent with the Welsh Government's ambition, which is to have children in school, there is lots of other advice extant that gives people of a different view, you know, evidence that they can point to say this is not the right thing to do. You know, during this period, the Education Minister and I are both separately served with a legal document from the National Association of Head Teachers saying that they will prosecute us if we open schools in Wales. No, I obviously would not agree with that, but the National Association of Head Teachers is not a frivolous organisation, and it would not have come to that conclusion if it didn't believe seriously that reopening schools in these circumstances, the alpha wave and so on, that was putting their members at serious risk. So while there is the evidence you have quite rightly pointed to here, it's not unambiguous and it's not the only advice in town. And there are other people who feel very strongly that schools must not reopen to the extent that they're prepared to take legal action against the Welsh Government to prevent that from happening.
Mr Drakeford, changing topic now, but staying anchored in 2021, I wanted to ask a few questions about international travel. You've said in your witness statement that engagement between the UK government and the Welsh government regarding international travel was a low point in intergovernmental communication throughout the pandemic. On the 23rd of June 2021, you wrote to Mr Gove regarding the UK government's proposals for relaxing the self-isolation requirement for those returning from amber list countries. We don't need your letter displayed, but in that letter you say, it is important for decisions regarding international travel to be taken on a UK-wide basis, and you hope that changes would not be made without agreement between the four nations. Now, we've seen calls for four-nation decision-making before, but when it came to international travel, did unilateral decision-making present an even bigger problem?
Well, in this area, the Welsh Government had only theoretical powers of agency, because most people who travel abroad from Wales don't do so from Wales and back to Wales. They go through ports in England and airports in England. So while theoretically we could make rules of our own, in practice they would have had no impact. So in effect, we simply had to do whatever the UK government decided in this area. I don't think the UK government was slow in coming to that realisation themselves. So the amount of discussion with us was pretty rudimentary, often very late in the day. Personally, I disagreed with the UK government's approach to international travel from almost beginning to end. But in practice, that made no difference at all to citizens in Wales, because the practicalities of international travel were not in the hands of the Welsh Government.
On the 23rd of July, you describe in your witness statement receiving an email informing you that the UK government was proposing to relax international travel restrictions for fully vaccinated arrivals from EU countries and the USA. It's INQ 000256899, and we've got it on screen there. Page bottom of page 1, there's a proposal to be discussed at COVID-0 with it coming into force as soon as the 2nd of August. You are asked for your views, and I think it is page 1, right at the top. You say, I think my reaction is, as it has been throughout, that the risks from international travel remain real and that the UK government's approach is not proportionate to that risk. Can you just explain what you meant and why you say that in that email?
Well, I believe from the beginning, as I say, to the end, that more could have been done to mitigate the risk of coronavirus, and particularly new variants of coronavirus arriving in the United Kingdom through international travel. The instinct of the UK government was always to liberalise travel as much as possible, and that meant, in my view, that they were prepared to take risks on importation that would better have been avoided. So it's just a fundamental difference of view. When it plays out week after week in all the practicalities, we would have had a stronger grip on international arrivals in the United Kingdom, and when they did arrive, we would have had stronger precautions to make sure that they were safe to be here, and we would have lifted those restrictions more gradually and for fewer countries at a time. Our view, in a practical sense, counted for nothing, because we couldn't make it effective. But that's what I mean there, that throughout the time, their approach underestimated the risks.
In a letter you wrote to Mr Johnson on the 5th of August, you described the UK government's approach to international travel and UK borders as chaotic and the engagement with the devolved administrations as shambolic. Looking ahead to a future pandemic, how is this to be improved in the future, in your view?
Well, it is chaotic and shambolic because of the pace at which changes are made. You really would need to be running a travel agency to have kept up with whether France is on the list today and Tobago is on the list tomorrow, because the lists were constantly changing. And the criteria against which it was decided whether or not a country would be on a list were changing as well. So I suppose my answer, I haven't given it a great deal of thought, truthfully, but my answer will be rooted in some of the answers I've tried to give earlier, which is that consistency and predictability of action would be as welcome in this area as it was in others. And it was very absent in this area.
Heading into winter 2021, Omicron, as we know, emerged as a variant of concern. Do you consider that the Welsh Government was overly cautious or overly pessimistic in the way that it responded to Omicron in winter 2021?
I don't. The advice we had was that Omicron was significantly more transmissible, and there were two things that we didn't know about it. We didn't know whether the available vaccines would have been as effective in dealing with this new variant as they had been with the pre-existing ones. And we didn't know whether Omicron would not simply be more transmissible, but that it could be a more serious disease. Now, you could try your luck and gamble on the fact that it wouldn't be more serious and that the vaccines would work. Trying your luck wasn't a basis of the decisions we would make. We acted on a precautionary principle that either of those things could have been true. Until we were confident that it wasn't true, we would protect the Welsh public from the potential impact.
Changing topic, Mr Drakeford, and just touching on public health messaging, which I appreciate we've already touched on already. You've said in your evidence that you were determined throughout the pandemic that the Welsh Government communications should speak to the people of Wales in a way that was clear, direct and honest. Now, I appreciate this is probably asking you to mark your own homework to a certain extent, but do you consider that that was achieved during the pandemic?
Well, I'll make one point, and maybe if you don't mind, I'll tell one story just to illustrate it. I'll do it as quickly as I can. So the general point is that my aim when I went to give press conferences was to share with the people listening the information that I had, and then to explain why the Welsh Government had come to the conclusions we had come to based on that information. But that information would allow people to make a different conclusion if they wanted to. I wanted them to know what I knew. And so I would set it out week after week. I'd say, this is the state of the virus, this is what we're being told, and this is what we now think we need to do. But I wanted to make sure that they always felt that if they thought there was a different conclusion to be drawn, people would be able to do so. Were we effective? Here's my very brief story. I woke up one morning at home, probably in July, one of the days when things are getting better. Cafes have just been allowed to open outdoors, and a BBC reporter is interviewing a group of ladies who have gathered at Verdi's, which is a coffee shop in the Mumbles in Cardiff, which they've not been able to do for many weeks. And he says to them, how have you been able to follow, the rules? It's all been very difficult. And this person says to him, well, at 12:15 on a Friday, we draw the curtains, we sit down, we listen to the press conference, and we do everything Mr. Drakeford tells us to do. At that point, I've had a rather sinking feeling, really. But that, in a way, I don't think that was untypical. The number of people who followed the press conferences was enormous, and the number of people who relied upon them to know what our advice to them was huge. And the willingness of people in Wales to comply with the extraordinary things we were asking of them was, I think, well beyond what you might have reasonably expected.
There were some high-profile instances of ministers and officials within the UK government appearing to contravene COVID regulations. We've heard Mr. Cummings's drive to Barnard Castle. Do you consider, from a Welsh Government perspective, that those incidents had any impact on the public's confidence in your government's handling of the pandemic?
I think there's some empirical evidence on this. Every month, the UK government paid for research. I think it was by Mori. We paid for a Welsh booster sample to get the views of people in Wales. At the start of the pandemic, trust in the Welsh Government and the UK Government are more or less at a par. Maybe the UK Government is slightly ahead of the Welsh Government in terms of trust. There comes a point, and it's around that time, when there's a big divergence in trust. So from there on, the Welsh Government's trust rating is around the 70%, sometimes a couple of points below, sometimes quite a few points above. And the UK Government's trust ratings are 40% or lower. So a 30% gap opens up between people's feeling that they can rely on what the UK government is telling them and what they think and how they think they can rely on what the Welsh government is telling them. And I think it's very, very much connected to a feeling that in some parts of the United Kingdom, there were people issuing instructions to others that they did not feel they had to follow themselves. And I don't think people thought that was true in Wales, and I can give you an absolute guarantee that it wasn't true.
Did you ever consider that your own ministers or Welsh officials' behaviour during the pandemic dented public confidence in Wales?
There are one or two incidents that are reported and much is made of them, but they're very infrequent. Well, my lady, you will know that a television company had complete access to the Welsh Government for months and months and, filmed us at work exhaustively. I don't think you will see anything there at all other than people absolutely scrupulously observing the rules that we had set for others and determined that we would always live up to what we were asking others to live up to.
I want to deal next with the Welsh Government's consideration of vulnerable and at-risk groups. And you say in your witness statement to this module, it's paragraph 70, that you initiated a significant amount of data collection and modelling in relation to at-risk and vulnerable groups and those with protected characteristics. First of all, how did the Welsh Government assess who would be considered vulnerable and at risk during the pandemic?
Well, we would essentially have relied on the protected characteristics list.
Dealing then, if I can, with older people first, you make the point in your witness statements, paragraph 68, that data and modelling in Wales took into account the relatively higher proportion of older people in Wales, and you point to the fact that the Older People's Commissioner was a member of the Shadow Social Partnership Council. Professor Nasru, in an expert report for all of the Module 2s, has highlighted in evidence to the inquiry that there has been no comprehensive study of ageing in Wales to capture the experiences of people as they grow older. If that is so, what sources of information were used to inform the Welsh Government's approach to vulnerabilities of older people during the pandemic?
I was puzzled when I read that, because I know from my own work at the university that there are very distinguished Welsh researchers who have reported on those matters in Wales. So I'm not absolutely certain that I agree with the point that was made. The work of Professor Judith Phillips, just to cite one example, is very significant and very highly regarded, and Judith is a professor who focuses on older people and has worked in Wales extensively. So I'm not sure I sign up to the idea that there isn't, there wasn't information available. But it is true, as I said in one of my first answers, that the scale of research available on a population of 55 million people is always going to be greater than is available on a population of 3 million. So I'm not saying that there are not gaps. There are, but I'm not sure that some of those gaps were quite as extensive as the advice the inquiry has had suggests.
Pandemic planning appears, though, to have treated older people as a homogenous group and not paid attention to which categories of older people might have been at particular risk. I mean, do you agree with that proposition?
I think to an extent. I don't think it would be true, for example, in our approach to black and minority ethnic communities, where we had some very specific policies aimed at older people in those communities. So I'm not going to say that across every protected characteristic we were able to disaggregate our efforts according to age, but I think where it was most available to us to make that difference, we did.
Briefly, what steps did the Welsh Government take to mitigate risks to older people in respect of, particularly, I'm thinking, the MPIs that were introduced in response to the pandemic?
Well, I suppose the most obvious one is that many older people were asked to shield from the very beginning. I don't think I've made, apologies if I have, that 4 members of my own ministerial team were shielding from the very beginning. So we were very alert as a group of cabinet colleagues that they were older people who we were asking to take even greater measures to protect themselves against the virus. So that's the most obvious example. And then through our local authority colleagues, we also instigated a series of measures to try to make sure that isolated older people would have the contact that they need, particularly through delivering food to them, making sure medicines were collected and delivered to them, and so on.
Debbie Foster gave evidence in respect of disabled people, which was looking at the impact on disabled groups in Wales. And she said she was largely left to her own devices, and she compared that with, to give an example, the Black, Asian and minority ethnic group. And this was interpreted, she said, by some members of the Welsh Government that they saw their work as less important. Is that the case?
Well, I'm very grateful to Professor Foster and to members of the Disability Forum who did advise us throughout the pandemic and who produced a locked-out report, which I attended a meeting with the authors, including Debbie Foster, shortly before the Senedd elections in May 2021. It's difficult for me to put myself in her position. I just want to say, I was very keen indeed that the Welsh Government took full account of the needs of black and minority ethnic citizens and disabled citizens before the pandemic started at all. By the end of 2019, we had working in the cabinet, and I was very insistent that these individuals would sit on the floor where cabinet colleagues would see them every day. So we appointed Professor Awobi from the Race Equality Council of Wales to be a specialist advisor to the Welsh Government, and we appointed John Luxton, who is, a leading campaigner in the field of disability, to be our advisors. And that was before the pandemic, and they sat on the cabinet floor where colleagues would see them and meet them and hear from them all the time. And while I'm quite certain there are things we didn't do and could have done, the fact that by the middle of April, within 3 weeks, we were engaged with people from the Race Equality Forum and the Disability Forum. And my colleague Jane Hutt met absolutely regularly throughout the pandemic with them, and we've taken action on the reports that they provided. I don't want to overplay it. I don't want to make claims beyond what we can, but I can say confidently that those matters always were in the minds of Welsh ministers.
We know that the British Medical Association raised concerns about the impact of the pandemic on ethnic minority groups, and we heard evidence in the first week of hearings from Professor Ogbonna. The Race Council Cymru wrote to you in early April. The first time you were briefed by the Black Asian Minority Ethnic Advisory Group was the 20th of May. Does that suggest an unjustifiable delay in focusing on a significant, vulnerable and at-risk group?
No, that really would be to misunderstand the sequence of events, because it's not that we get contacted on the 14th of April. There was a letter from Judge Ray Singh, and then don't do anything about it until the 20th of May. By the 20th of May, the work of the forum was well underway, including the production of the risk assessment tool that members of black and minority ethnic clinicians themselves devised in order to make sure that people from those communities were not unfairly placed in the front line given the susceptibility to the virus. And that risk assessment tool was used not just in Wales, but very widely, including in the Houses of Parliament as well. And all that work was going on between the receipt of the letter and the time that Professor Ogbonna and Professor Kesh Sengal, an orthopaedic surgeon who'd led the work on the risk assessment tool, by the time they came to speak directly to the Cabinet about it.
The inquiries heard evidence that at the start of the pandemic, Wales had the highest level of child poverty in the UK at 31%. What measures were put in place to ensure a minimum level of welfare provision for children living in poverty during the pandemic?
Well, the levers available to the Welsh Government to directly affect poverty are very limited. The major levers are the social security system, the benefit system, and macroeconomic policy. But we were the first government in the United Kingdom to guarantee that free school meal payments would continue throughout the school holidays, and we continued them for longer than any other part of the United Kingdom as well. So there is one intensely practical action that was in the hands of the Welsh Government and which aimed to support those families with the least resources to assist children and young people during the pandemic. We also, as I said earlier, having closed schools or advised the schools should be closed on the 18th of March, by the 23rd of March, schools were open for vulnerable children and children of key workers. And one of the reasons why we, differently to other parts of the United Kingdom, asked every child in Wales to come back to school in the end of June and beginning of July of 2020 was because of our anxiety about safeguarded children. Children who wouldn't have been seen by a social worker in those months, who normally would be visited regularly. We wanted to make sure that those children presented themselves somewhere where adults could make an assessment of their well-being. So, within the limited levers that we had, I think we did our best to use them to the benefit of those children who needed our help the most.
It has been set out in the inequalities evidence of Professor Becares, who reported on the impact of the pandemic on LGBTQI+ communities, that there is an increased prevalence of pre-existing physical and mental health conditions among LGBTQI+ communities. First question, I suppose, is was the Welsh Government aware of this going into the pandemic? And then secondly, did it factor into decision-making?
I could not claim that I was aware of some of that evidence going into the pandemic for the purposes of ensuring that the needs of that community in Wales were known about and discussed. I relied primarily on two ministers in my ministerial team who belonged to that community and who were assiduous in making sure that where there were issues drawn to their attention that were relevant to that community, that they would be shared with the Cabinet where we were able to take collective action to address them. But I can't say that it was necessarily more systematic than that, but we did have representatives around the table every day who had particular capacity to make sure we were aware of those issues.
Digital exclusion has been highlighted by a number of the inequalities experts as a bar to receiving timely updates about the rules, guidance, access to help, and also healthcare during the pandemic. How was the risk of this form of isolation taken into account in Welsh Government decision-making?
Well, the fact that we relayed our decisions through televised news conferences, and from the very beginning we had a British Sign Language interpreter there with us to communicate to people who wouldn't be able to hear what we were saying, and that there were 250, I think, press conferences held during the whole of the pandemic. I think that was our major effort to make sure that we weren't simply relying on a website or forms of access that people wouldn't otherwise have. But you know, it is a rare person in Wales who doesn't have access to a television. And given that we were using that as our primary means of making sure the most widespread communication was available, I think that was a reasonable course of action.
Mr. Drakeford, final topic, lessons learned. You contributed to the Welsh Government's Lessons Learned for Good Practices and Areas for Further Development. It was published in 2022. We can see it on the screen, and for the record, it's 30182549. If we can have a look at the second page of that, the third paragraph, thank you, set out there. That's a summary of the key lessons emerging from that exercise. Would I be right to assume that you would commend those key lessons to the inquiry?
Well, I do commend them, but I just want to be clear that they are recommendations about the internal workings of the Welsh Government rather than wider recommendations. The exercise was to look at how the Welsh Government itself had discharged our responsibilities. It drew on the experience of many people who worked in the Welsh Government during that period, and the key lessons are well summarised on that page, but they don't necessarily translate into wider lessons beyond the internal workings of the government itself.
And if there was a single lesson that you learnt during the pandemic, what would that be?
Oh dear. That's a difficult question, isn't it, to think of late in the day. Well, I'll probably just return to a theme which I've raised a number of times, that predictability, orderly conduct of government, the willingness to be round the same table together, even when decision-making is dispersed, availability of authoritative evidence which has signs of internal challenge in it, and then a commitment to follow that advice as part of the decision-making process. To varying degrees, those qualities were not sufficiently present in the way that the pandemic received a response across the United Kingdom. And if those lessons could be learnt and those strands strengthened for the future, I think it would be to the advantage of us all.
Mr. Drakeford, thank you. They're all the questions I've got for you, but there are some questions from call participants.
Ms. Haddon.
Good afternoon, First Minister. I represent the Covid-19 bereaved Families for Justice Cymru. In your witness statement, you state as follows: sadly, too many families have lost loved ones. This cruel virus has stolen lives, and it has left their loved ones with questions which they rightly want answered. First Minister, you are entirely correct. The Welsh bereaved do want answers, but they want to see that you've openly reflected on your handling of the pandemic and learnt some lessons. Now, the Welsh bereaved have pored over every word in the statements that you've given to this inquiry, and indeed they've sat here today and listened very carefully to everything that you have said. They are therefore deeply disappointed that in all of your evidence to this module, including your oral evidence today, you will not accept that there was anything that the Welsh Government, and in particular you, did wrong. Now, you told CTI at the start of your evidence that you were not here to justify and you were not here to defend. But unfortunately, that's exactly what you have done. You've refused to accept that you should have read the signals of risk earlier and acted sooner, instead relying on hindsight. On asymptomatic transmission, you've refused to accept that a precautionary approach should have been taken. You've refused to accept that you should have cancelled mass gatherings. You've refused to give an unconditional acceptance that you failed to plan for the pandemic. You've defended the 2 delays by the Welsh Government on introducing testing in care homes. And you've tried to explain away the Welsh Government's obviously illogical divergence on face coverings. Now, Nicola Sturgeon, Matt Hancock and even Boris Johnson were able to identify some things that they got wrong when they gave evidence to this inquiry. So, First Minister, can you please explain to the Welsh public why you are so reluctant to accept that the Welsh Government, indeed yourself, may have made some mistakes in the handling of this pandemic?
Well, first of all, my lady, I'd like to thank members of the Bereaved Families Cymru for the opportunities I've had to meet with them and to pay tribute to them for their being here at the inquiry. I tried to say at the beginning that I wasn't here to justify. I was here to explain. I don't think the test for me is whether I got everything right, because I don't think anybody could possibly pass such a test. What I have tried to do is to explain why I think the actions we took at the time were reasonable in the context of the information that we had at the time. And that is not to say at all that another reasonable person could not have come to a different conclusion. So, Ms. Heaven, I suppose I don't sign up to your propositions. I hope that in the decisions that I made and my colleagues made, we were reasonable in our assessment of that evidence. I don't make a higher claim than that. As I say again, other reasonable people could have come to a different conclusion. That's not the same as saying that we got everything right. I don't claim that at all.
Okay, let me move on then to my topic of the fire break. Now, you have been asked a lot about this, so I'm going to just cover some...
Sorry if I stole any of your thunder.
No, not you. I'm going to go on to new topics. Now, we know that money was eventually made available in Wales, and indeed we know obviously that the fire break did happen. And I'll look at a moment at the money. You've seen the SAGE advice obviously on the 21st of September. You've been taken by CTI to that TAG advice and series of advices, which was tracking the deteriorating picture. So my question is this. Knowing what you did then in September, did you commission anyone in the Welsh Government to consider the financial implications of introducing a fire break and the funding options that might be available to the Welsh Government in September? Or is the very first time you put pen to paper and think about this issue the 16th of October when you write that letter to the Chancellor Rishi Sunak?
No, of course we'd been thinking about that topic well before then. As I said in my earlier evidence, I had raised it as early as the 22nd of September with the UK government. The Welsh Government is mobilising enormous sums of money to assist Welsh businesses over and above the money that comes from the United Kingdom. And there is evidence throughout the month of October of how we are looking to see what more we can do from our resources to be able to go on assisting businesses, given that we know that a fire break has to be considered. What we're not able to do is we're not able to mobilise resources at the scale that only the UK government can, and we're not able to use the mechanisms that are only available to the UK government to get that money into the pockets of people who need it.
First Minister, can I press you there? Because you provided a very detailed witness statement, and we have gone through it. We can't find any evidence that you personally commissioned somebody to look at the Welsh Government finances in September on receiving that really quite devastating advice that we've looked at with CTI as a matter of urgency to understand whether you had the resources to introduce a fire break. So can you give us a bit more specificity? When did you commission that advice?
Well, I think probably you're looking for the wrong piece of evidence, because that is not how it would have happened. So my colleague Ken Skates, as the Economy Minister, and Rebecca Evans, who you heard from yesterday, worked together to find money that we could use to support businesses through these very difficult times. They were working on that throughout those early weeks of October, and there is plenty of evidence that is already available, not in my statement necessarily, but in the workings of the Welsh Government, to show how that I wouldn't have commissioned it, I think.
Well, let me move on. Let me move on, because as you know, I've got limited time. I want to ask you about the document then, please. INQ 30395 please.
Well, that comes up. I must apologise. I think I called Miss Evans Miss Mason earlier. So
Yes, Rebecca Evans.
sorry.
Yes, not Toby Mason, it was Rebecca Evans yesterday. Yeah. So this is an email here from Fliss Bene, 5th of October, and of course she needs no introduction, that was sent to your office and to your special advisors. Given the likely increase in COVID across the board, the fact that we do not yet have enough evidence to show that people are complying, and the need to have a definitive effect on the R number, I would suggest that the First Minister may wish to ask CDL whether they are willing to provide economic support for a fire break / circuit breaker around half term. So that, as we can see, goes to your office to 2 emails, and it goes to Jane Runnicles. Now, I can tell you, I'm not going to put it up, but you can take it from me that you had a call with CDL, indeed on that day at 15:45, and there is absolutely no reference to a fire break, and there is no reference to economic support. The topic just didn't even come up. Can you assist us with that, please?
Well, I don't have the notes of that meeting in front of me, so I imagine that he was dealing with other matters. But the record shows as clearly as can be that well before the 5th of October, I am asking the UK government for the financial help that will be needed, and I continue to do that at the opportunities that I have directly with the Prime Minister, undoubtedly with Mr Gove, and it culminates in the exchange of letters that we rehearsed earlier this afternoon. Of course, it was fundamental to us to have the support of the UK government for the actions that we were taking, and I can absolutely assure you that I raised that wherever I thought I was likely to get a positive response, even though in the end we didn't.
Moving on to the COBRA meeting that we know took place on the 12th of October, we don't need to bring it up. CTI has shown you the note of that. We can obviously see there that on that day the Chancellor explains the package amongst other things, and you make a contribution on that day, don't you? As you're talking about, I think, the border issues. You're also asking, is there going to be another COBRA on the fire break? So can I ask this? Why, on this day, on the 12th of October, at this late stage, are you still asking where the COBRA will be held to discuss circuit breakers? Surely by this stage, the Welsh Government should have met with its own cabinet, it should have conducted all its planning, and it should have taken its plans and demands to COBRA. And is the fact that you didn't do this an example of your poor leadership?
I'm sorry, I missed the
Is it an example of your poor leadership? The fact that by the 12th of October, here's your opportunity, you've got a COBRA, that you didn't go there prepared with your modelling, with your data, with your plans agreed in Cabinet. You've spoken to the unions, you've got it all lined up, and there you are, you're going to present it to the Chancellor on the 12th. That was your opportunity, and you missed it, didn't you?
Well, I think that would be quite badly to misunderstand the context of the Cobra. That would be so far in advance of the facts, and particularly where the UK government was, that it would have been an effort not only wasted, but very likely to be counterproductive. The reason I asked for a special meeting on the circuit breaker advice is the reason I provided earlier, which is that the Prime Minister was so emphatic in that meeting that he wasn't prepared to agree to a fire break, and that he wouldn't be willing to support the Welsh Government in our actions, that I needed to have another run at that argument with him separately from the wider set of issues that were discussed. Had I turned up there, not only to ask for the UK Government's general support for that proposition, but with a detailed plan for doing so, I really don't think we would have had a hearing at all.
Final document then, please. Can we look at INQ 30s 227915? Now, just to understand, you're not at this meeting. This is minutes from the Finance Subcommittee Group, Partnership for Council of Wales, 2nd of November. Now, it turns out Wales had its own fundraising capacity and reserves to support a fire break and to support workers. So if we just have a little look down onto the next page, please. If we see point 5, as a result of the fire break, additional funding has been made available to businesses and employers in Wales, and this will be reviewed in light of recent developments in England. The MFT, so that's obviously Rebecca Evans, had announced on the 23rd of October an extra 10 million to help protect workers at risk of falling through the gaps. So, pausing there, First Minister, it's right, isn't it? It's totally disingenuous of you and the government to blame the UK government for the timing of the fire break, because in reality, Wales had the money to support a fire break. The only person responsible for the timing of the fire break in Wales and the fact that it probably came too late is you. So will you now not accept responsibility for this and for the inevitable spread of the virus and the deaths that occurred because of your lack of decisive action? Will you accept that?
Well, I absolutely accept that it was my responsibility in the end to decide on the implementation of the fire break. I'm afraid the question very badly misunderstands the level of financial assistance that will be needed in Wales to support not just those groups who were not covered by the UK government's schemes. That's what that £10 million is for. It's for the freelancers fund, for example. Freelancers weren't covered by the furlough scheme that the Chancellor funded. £10 million is a small amount of money to pick up people who weren't covered in the main scheme. I'm afraid I think you've answered your first question. You suggested to me that we weren't doing anything to model the money that will be needed. Here is the practical example of exactly what we were doing. We were using our resources to supplement what only the UK government could do, and my responsibility was to do everything I could to get them to support the public health action that we knew we needed to take in Wales.
Just finally, though, what I put to you is that you were being disingenuous in your witness statement to the inquiry, where you were blaming the UK government for the timing of the fire break. That's right, isn't it? You can't blame the UK government.
No, it's absolutely wrong. And it completely misunderstands the division of responsibilities between the Welsh Government and the UK Government. We were able to mobilise our resources to fill the gaps in what only they could do. Without their willingness to provide the help that only they were able to do, we were inhibited from taking the action we needed to take in Wales. That's what those letters are about. I failed to persuade them, and I cannot help but notice that as soon as it was necessary for them to take that action, they did find the resources. But my efforts at this point are all directed to asking the UK government, we've got to take this action, please will you help us? And there's no chance at all that the Welsh government can simply step into that space. We have neither the resources nor the mechanics. We cannot instruct HMRC to make payments to anybody. So it's not disingenuous in any sense at all. It is simply a factual explanation of where the responsibilities and the capabilities for action lay, and the fact that I wasn't able to persuade the UK government to take action that only they could take had an inhibiting effect on our ability to do what we wanted to do in Wales.
Thank you, First Minister. Thank you, my lady.
Thank you, Mr. Mr. Straw.
Good afternoon. I represent John's Campaign and Care Rights UK. You mentioned towards, at the end of your evidence with Mr. Poole, that among other areas, the availability of authoritative evidence wasn't sufficiently present during the pandemic. Some stakeholders, including those involved in the care sector, considered that concerns they had raised weren't taken into account or weren't acted upon. Is this one of the areas in which not enough was done to obtain and make available evidence?
I don't think that the point that the sector was making was about lack of evidence. I think they felt, and many other sectors felt, that getting their case heard and recognised on the terms that they would have put it to the Welsh Government was as straightforward as they would like it to have been. But I'm not sure that it was absence of evidence that they were pointing to rather than access.
So trying to understand then whether there was a point in the sort of chain of decision making where there was a problem. So they've said that they've made their concerns and the concerns weren't acted upon, they weren't implemented. Is there some point in that chain where there was a problem?
I think there are a whole series of difficult factors at this time. It's the sheer scale of everything that the Welsh Government is trying to respond to. The sector itself, as you know, is quite a disparate sector in Wales. The characteristic ownership pattern of care homes in Wales is not the pattern in England, where there are a small number of very large corporate providers. We've still got lots and lots of owners of care homes who have one or two care homes, and the sector has a job which it works hard to do to be able to represent the views of a very disparate audience. Evidence is gathering all the time around us at this point as well, so it's not as though there is a fixed body of knowledge that everybody can agree on and point to. So I think there are many contributory reasons to the point that you made in introduction. So
perhaps sort of getting together these disparate sources of evidence may have been an issue. Would that be fair?
I think that it is possible, but it's not just evidence. It's sheer practicality of things, like how do we get PPE to care homes in Wales? There is no single register of where every care home in Wales is located. We were very fortunate, my lady, to have some expert logistical support from the armed forces early on in the pandemic, and one of the things that they focused on was something as basic as being able to help us to make sure that we had, all the information we needed and the most effective way of being able to mobilise the help that we wanted to provide to the place where it was needed.
Looking at another part of the process, so from bringing forward the evidence from stakeholders to then implementing the concerns that they raised, the Older People's Commissioner and also Professor Debbie Foster have talked about an implementation gap. So even where the concerns of stakeholders were recognised in central government, it got stuck somewhere. So the concerns weren't then implemented. Would you agree that that was a problem? Well,
I certainly agree with this, that if you believe there is a model of government in which, in Cathays Park here in Cardiff, a minister pulls a lever and something happens out there on the Llŷn Peninsula, then it really isn't like that at all. There is a complex pattern of intermediaries, and there are many ways in which, particularly in the beginning, making sure that decisions were translated into practical impact on the ground was challenging.
In terms of learning lessons, is there something that can be done to improve the position in future?
Well, I do think there are, and I think some of those things are the lessons that we learnt during the process itself. So just something as simple as there not being a central register of every care home in Wales. Each local authority would have its own register, but there isn't one consolidated place where that information is kept. So I think there are some very practical lessons that can be drawn from the experience, just in making sure we have those basic components in place so that then we can act more swiftly and more effectively than we were able, particularly in those early weeks.
There's just one more question about this topic, and to try and illustrate the sort of broader systemic problems just with a specific example. A number of stakeholders raised concerns about the adverse impacts of bans on visits to those in care. And you yourself, on the 11th of November 2020, in a call with the other First Ministers and Michael Gove, appeared to recognise the problems in that you drew attention to the really heartbreaking set of restrictions, as you put it, on care homes, on those in care, and suggested liberalising them by use of testing. Now, despite what you'd acknowledged at that point, there remained essentially a ban in place until May 2021. Does this illustrate any sort of broader issues in the systems in place? Could something have been done better to ensure that changes which had been recommended were put in place?
Well, I hope so. I said right in the very beginning, I visited my mother on the 22nd of February at her 90th birthday. I didn't see her again for many, many months. So, the heartbreak that people feel about being separated from people who mean such a lot to them is very real. I think there are two areas where I wished it was much, we could have done much better. I wish it was easier for people to visit into care homes, but I knew, because of the evidence I saw, that the importation of coronavirus into care homes full of vulnerable people was generally brought in by people who were coming in from the community to do so. So much as I would have wished myself not to have been standing outside a window trying to talk to somebody, I also knew that I would be a risk to them if I did go in. So that's what you're balancing. So I wish we had a better formula for it. We tried some practical things. We tried to find outdoor spaces where people could meet and things like that. They were, they're all things we should learn from and look at. And I very much wish that we could have found a different formula for people to be able to meet with loved ones in their final days or hours. Because
of the time available, I'm going to have to move on. I've just got two more topics. The first concerns expert groups. So you explain how the Black and Minority Ethnic Covid-19 Advisory Group was formed, and that, of course, was a very important group. But those needing care were also at the sharp end of the pandemic and the response. I mean, just to take an example, in the first 3 months of the pandemic, statistics indicate that around 39% of deaths in the UK involving Covid-19 were deaths of care home residents. Would you agree that an equivalent advisory group, similar to the BAME group, should have been formed at an early stage?
Well, we have the Older Persons Commissioner for Wales, who is specifically charged with representing the views of older people, and she has done an enormous amount with people who lived in care homes and worked in care homes, and was a very powerful voice for them throughout the pandemic. Personally, I'm a believer in, just as we have a schools council in every school in Wales, I'd have a care council in every care home in Wales myself, because I do think that the voice of people who live in those settings does need to be amplified. The idea that's put to me is one of them. But during the pandemic itself, we relied very much on the good offices of the Older Persons Commissioner, and she was a very powerful and I think effective voice on behalf of people in the care sector and beyond.
Well, the suggestion of a care council is a very interesting one. The last topic, discharge from hospital into care homes. Firstly, you've discussed this already with Mr. Paul, so I've got just a couple of specific questions about it. You noted earlier that there was limited testing available at the time. But in fact, there were only a pretty limited number of people being discharged per day from hospital without prior testing. So some of them already had testing, the asymptomatic ones didn't. I think the figures are somewhere between 11 and 18 people being discharged a day. Whereas in mid-March, there were about 1,800 tests available, and the number increased. Would you agree that allocating this pretty tiny proportion of the tests to discharged patients was justified by the huge risks involved?
Could make maybe one point I haven't made earlier, and I think sometimes in the sort of public prints on these matters, it appears as though what happened was in March that there was a wholesale discharge of people from hospitals into care homes. In fact, fewer people left care homes, fewer people left hospital for care homes in March and April 2020 than had left in the previous year. So actually, it wasn't, and this is a fair point that's being made. The numbers were not, were not enormous, and maybe the amount of testing that would have been needed could have been accommodated. That's not the advice that ministers had at the time, but I think it's a fair point that's being made.
You fairly made the point earlier that these patients were unsafe in hospital because of what was happening. But there's a sort of slightly different question, which is about whether they should be tested, whether asymptomatic patients should be tested prior to discharge. Do you accept that taking the government and its scientific advisors collectively, so not you specifically, but the whole lot, that this was a mistake?
Well, I'm afraid I think this is classically an example where knowing what we know now about asymptomatic transmission, if we'd had that state of knowledge at the time, we would undoubtedly have been testing people. At the time, that knowledge didn't exist. The advice that we were still getting at the end of April and was still being advocated by some scientists for a couple of months after that was that asymptomatic transmission was not a primary cause for concern. So it's a matter of what you know at the time, isn't it? Had we known at the time, I think we would have acted differently. But we didn't know at the time, and what we were told at the time would not have supported diverting tests from other purposes to testing asymptomatic people.
Okay, I'm going to have to finish there, but thank you very much.
Just before you sit down, Mr. Straw, in case I raise anything, sorry, Mr. Strick, haven't quite followed that. I thought you agreed with Mr. Straw that it was a fair point to make, that given the limited number of those being discharged, they could have been tested, because those with symptoms were tested. This is the point you're making, Mr. Straw, and I thought you agreed that it was a fair point,
Yes.
that those without symptoms were sufficiently low in numbers and I thought you agreed that could be accommodated. And then you seem to have said, but we weren't getting that advice at the time, therefore. So is it a fair point or isn't it?
Well, it's a fair point in this way. It's not a fair point in that the evidence we had didn't say you would do that. But I think the point that was being put to me was, even though you have a limited amount of tests, the number of tests you would have to divert for this population could have been small enough to accommodate, even within the limited number of tests that you had. And I think that is a fair point. I would need to go away and look at the numbers and look at the availability of tests to see whether that was a practical proposition. But as a basic proposition, you haven't got many tests, but you don't need many of them for this group. It's a reasonable point to make as well.
And we know how vulnerable people in care homes are.
We do.
Thank you.
Thank you, Mr. Straw. Does that complete the questioning?
It does, my lady, yes.
Mr. Drakeford, thank you very much indeed for your help, both in this module and the previous module. I don't know what life has in store for you when you step down as First Minister, but obviously we wish you well.
Thank you.
Thank you.
Thank you.
So does that complete the evidence for today?
It does, my lady.
And therefore tomorrow we turn to closing submissions at 10 o'clock, please.
All rise.